Sarah Sheik. I'm a mindfulness educator with MCPS. Today we're going to be learning about the signs of stress, and we'll practice a technique that helps reduce our levels of stress and increases balance. We don't all respond to stress in the same way, and sometimes stress is helpful. There can actually be a positive impact. Stress can motivate us, it can energize us to meet an important deadline or to defeat an opponent in a game or to get in front of a class and give a presentation. However, stress has also negative effects on our mental abilities, on our physical selves, and our emotions. So today we're going to be learning about the signs of stress, and I want you to consider which signs affect you the most. Consider your levels of stress over the past month. And I'm going to read a list of signs, and I want you to make a mental note. Yes, this sign of stress affects you, or no, it really doesn't. You could also have a pencil and a paper and just make a check mark to notice which signs affect you the most. So let's start with the physical signs of stress. Yes or no? Have you experienced an increased heart rate in the past month? How about rapid breathing? Have you experienced headaches? Changes in your eating habits, either overeating or having a loss of appetite? Dizzy spells? Feeling tired? Having insomnia, which is a lack of sleep, a lack of ability to relax and sleep? Feeling restless or crying easily? These are all common signs of physical stress, but it's also not the complete list. Let's move on to the effects of stress on our mental abilities. Take a mental note, yes or no. Difficulty remembering things. Feeling confused. Difficulty making decisions. Have you noticed you've had difficulties concentrating? How about a lower quality of work or that affects your grades? Feeling less productive than normal? Feeling overwhelmed? Or feeling less motivated? Okay, let's talk about emotional reactions to stress. Have you experienced an increase in depressed feelings, an increase in fear, feeling hopeless or helpless, feeling anxiety? Have you had difficulties with relationships? How about a loss of sense of humor that comes with stress? Feeling irritable, easily angered, overreacting to other people, or feeling numb and not caring about the things that you typically care about. Think over the past month and let's rate our level of stress on a scale of 1 to 10. 10 being the most stressed out you've ever felt, and 1 being the most calm and relaxed. Where do you fall on the scale over the past month? Today, we're going to be learning a breathing technique that helps us reduce levels of stress in our physical, emotional, and mental state. Breathing is just one strategy we can use to decrease stress levels. Today, we'll learn and practice a breathing technique called alternate nostril breathing. It's also called the U-shape breath. It's really more like an upside down U. This breathing exercise, alternate nostril breathing, helps to reduce anxiety and stress levels. It also helps to oxygenate both hemispheres of our brain and increases energy in our body as well as our mental abilities. So let's practice this technique together. Okay, we'll first start with a simple mindful movement warm-up, and then we'll move on to our alternate nostril breathing technique. Let's try this out. Begin in a comfortable seated position with your feet firmly on the earth. Rest your arms and hands in your lap. Sit up nice and tall. Take a deep breath in through your nose and a deep breath out. Mindful movement. Let's begin by bringing our chin to our chest. Inhale, look up as far as comfortable, and exhale back down, chin to your chest. Inhale, look up. Exhale, back down. Inhale, roll your right ear to your right shoulder. Draw your head back in a circle. Exhaling your left ear to your left shoulder and chin to your chest. Rolling to the right on your inhale and back. Exhaling to your left, chin to chest. Let's reverse. Inhale to your left and back. Exhaling your right and down. Once more, inhale. And exhale, chin back to chest. Bring your chin to neutral. Shrug your shoulders up to your ears. And exhale, drop. Inhale up. Exhale, relax. Once more, inhale up. And exhale, back down. Good. Take your left hand to your right knee, your right hand behind your back for support. Inhale, sit up tall. And exhale, let's twist to our right, gaze over your right shoulder. 2 breaths. Inhale. Exhale, 1. Inhale. Exhale, 2. Inhale, come back to center, hands on your knees. Now take your right hand to the outside of your left knee, left hand behind your back for support. Sit up tall on your inhale, and exhale, twist to your left, gaze over your shoulder. Breathe in. Breathe out. Breathe in. Breathe out. Great. Inhale, come back to center. Lace your hands together. Turn your hands inside out. Pull your hands away from your heart. Spinal flex. Reach your arms up as you arch your lower back, middle back, gaze upward. Exhale, round your lower back, middle back, shoulders move forward. Inhale, arching lower back and middle back, chest rises to the sky, and exhale, round. Lower back rounds, middle back rounds. Good. Inhale, back to center. Take a deep breath in through your nose and deep breath out. I'll demonstrate alternate nostril breathing. With alternate nostril breathing, you'll take your right thumb and close off your right nostril. Breathing in through your left nostril. Use your ring finger to close off your left nostril, exhaling through your right nostril. Inhale through the right. Close the right side, open the fingers, exhale through the left. Inhale through left. Seal the left nostril, open the right, exhale. Okay, so that's the basics of alternate nostril breathing. It's U-shaped because we're inhaling one side and exhaling through the other nostril, and then inhaling through that same side and exhaling through the other side. So it's like this, up and around, upside down U shape. So let's begin. We'll do this several times together. Starting by closing the right nostril. Take a deep breath in. Seal your left nostril. Exhale through the right. Inhale right. Seal the right. Exhale left. Inhale left. Seal the left. Exhale right. Inhale right. Seal the right. Exhale left. Inhale left. Close the left. Exhale right. Slow inhale through the right. Seal the right. Exhale left. Inhale left. Seal the left. Exhale right. Feel free to soften your gaze or close your eyes. Inhale right. Seal the right. Exhale left. Inhale left. Seal the left. Exhale right. Inhale right. Close the right. Exhale left. Last round. Inhale left. Seal the left. Exhale right. Release your hand. Breathe in deeply. Breathe out. A couple more times at your own pace. Inhaling. Exhaling. Check in with yourself. Notice how you're feeling in your body, in your mind, and in your emotions. Have you noticed any shift? And let's go back to our scale of 1 to 10. Right now, in this moment, where are you on the scale of stress? 10 being the most feelings of stress in your physical body, emotional, mental body. 1 being the most calm and relaxed. Where are you right now? And take note of any small shifts. Small shifts are fantastic. This can be practiced anytime, especially when you're starting to notice that your signs of stress are building up. They're starting to accumulate. Pause, slow down, take a deep breath, or practice the alternate nostril breathing, also called the U shape. I like the visual that helps me remember how to do the technique. I encourage you to do this often and to really start to notice how stress shows up for you on a daily basis and throughout the next month. Thank you so much for your attention today, and I look forward to seeing you next time. I offer my respects to all of you.